Hi, my name is Kelly, and I'm here to do a comprehensive diabetic foot exam. My patient is a 70-year-old male patient who has had type 1 diabetes for 68 years. He has a history of absolutely no ulcers on his feet, and as you can see, no amputations. So that's good. That's a good thing. First, I'm going to look for any obvious deformities of the feet. Like I said, there's no amputations. There's no evidence of hammer toes, claw toes, curved toes, bunions, calluses. If you did have the hammer toes or curved toes, what it does is it puts increased pressure on the points that are making contact first with the ground when you step. So that would increase your risk of any calluses in those areas, but there are no obvious deformities. I'm going to check for equinus right now, and what that is if your foot, typically your foot can bend back towards yourself further than a 90-degree angle, so I'm just going to lift up your leg and I'm going to bend your foot towards you. Okay, great. Now what that is, so this right one is great, I'm going to check the left one, and what that means, oh goodness, a little pop there, is if you couldn't bend your ankle more than a 90-degree angle, then all that pressure every time you walk puts you at increased risk for calluses and ulcers right here across this part of your foot. So that's great that you still have that flexibility. Now I'm going to check for metatarsal plantar flexion, and what that is, these are your metatarsals right here across here, and if they were plantar flexed, it would be lower and closer to the ground here. The alignment would be off, and you have no evidence of that on either the right or the left foot. And again, that would put more pressure in this area, and it would cause increased risk of ulcers developing in this area. Next, I'm going to do the skin exam. I'm just going to feel the tops and the bottoms of both of your feet, and they both feel normal body temperature. They're not too cold, not too warm. Too cold could indicate a circulation problem, and if one foot was really warm, it could indicate an infection going on in that foot that's not apparent yet. So the temperature feels great. I'm going to check your toenails. There is no thickening, and that would indicate maybe some possibility of athlete's foot or tinea pedis. Checking in between the toes for the same thing. Some dry scaly patches might indicate some tinea pedis as well. I will just make note that the patient does have a blackened toenail. He dropped something on his foot earlier, and it is healing nicely. I'm going to check your capillary refill, and that is when we press down. This kind of helps tell us about circulation. We press down on your toenail, it turns white, and within 3 seconds we want it to turn back to the regular pinkish color of the nail that it normally is. And this is something you can do on your own. I'm not going to press it on because I'm sure it hurts. You can do this on your own to check how your circulation is doing every day. Okay? Okay. I did, like I said, there is no evidence of calluses. There is a little bit of a, there is a little bit of a bunion here at the beginning, and but there's no dry skin and no rough, thickened callus area. But this is an area to watch to make sure that a callus doesn't form here from extra pressure that your shoe will put on that every time you walk. I don't see any evidence over here of the same thing, so just on this foot, keep an eye on this area right here. Okay. Yeah. Okay. I'm going to check your ankles for any swelling. It does not appear to be any. You have a little bit of varicose veins back here, which is a real common area to get them. And it just indicates that there's the beginning of a little bit of circulation, decrease in circulation to your feet. I'm going to check your pulses. The top pulse is your dorsalis pedis, and it should be the same in both feet, and it is very nice and strong. That's good. And then this one is your posterior tibialis. And this one feels nice and strong as well, so that's good. That indicates that the blood flow is getting down here where we want it to go. Next, I'm going to check the feeling of the feeling sensation in your feet. I'm going to use this little device. It's called a monofilament. I'll let you feel it so that it's not, you see, it's not real sharp or anything. It's kind of like fishing wire. I'm going to have you close your eyes, and I'm going to touch you with this, and you tell me when you can feel it, okay?
Okay. Yep. 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 Yep.
Good.
Yep. 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 Yep.
Okay, great. This is actually the gold standard test for sensation that we test for, and it's the amount of pressure needed for you to be able to tell if you're stepping on a rock, if there's something in your shoe when you put your foot on. So this is the most accurate test for the sensation in your feet. Next, we're going to go to the vibratory sensation in your feet. The vibratory sensation, if you were losing any sensation, you would lose the vibratory sensation first before this soft touch. So this is a tuning fork. I'm just going to hit it with my hand, and I would like you to close your eyes and let me know when you feel the, do you feel the vibrations?
Yes.
Okay, and tell me when it stops, okay?
Stop.
Okay, that's good. What we're looking for is, if you told me that it stopped and I could still feel that it was vibrating, that would indicate the beginning of some loss of vibratory sensation. So now I'm going to check the other one. Can you close your eyes, please? And just let me know when you feel that it stops.
Yep.
Okay. All right, very good. And our last sensation feeling is you're going to feel, I'm going to either do something that's soft or hard or sharp. We'll say sharp or soft. When I touch you, you tell me if you feel it sharp or soft, okay? Okay.
Soft. Hard. Soft.
Okay.
Hard. Hard.
Okay.
Soft. Hard. Hard. Soft. Soft. Hard. Soft.
Okay. Very good. Okay, so what we would do typically with just any diabetic at all needs to be seen once a year by their foot doctor. I know you said that your doctor looks at your feet maybe every couple of months. That's great. But do you ever, if you do ever consider going to an actual podiatrist to get your foot checked, or a diabetic podiatrist is even better. But if you were to have any neuropathy, any problems with the sensations and feelings, we would ask that you go every 6 months. And if you had any neuropathy and problems with circulation, we would need you to go every 4 months. And if you ever had a history of ulcers, we need you to go every 2 months. Okay. So, but right now, once a year would be great for you to go to the foot doctor. Thank you.
Great, thank you.